Hey, this is Chris Dewey with May River Medicare, and you've indicated on our website or through our videos that you are new to Medicare. You are going to be 65, turning 65 and getting your Part B in 6 months or less, or maybe you just turned 65, or maybe you're 65 and a half and you put things off. So what this quick video applies to you. You are folks that are looking for the best Medicare supplement plan with predictable premiums. You don't want copays. You don't want $400 a day Medicare Advantage hospital copays or $10,000 a year maximum out of pocket. You don't want that. You want predictable premiums with no copays, no network, so you have the freedom to go anywhere that you want to go to. Now, before we dive into this, I want you to know this happened to me last week. This is a true situation that happened to my client and his brother. So to show you how important the first 6 months of your Medicare life is, I want to tell you about a gentleman I met last week. His name is Oscar. Oscar, when he turned 65, 7 months ago. And he went with a Medicare Advantage plan because his brother, who's 70, said there's no way he would get accepted with a Medicare supplement because his brother got rejected for taking insulin for diabetes, and he also had some heart issues. So he said to us, there's no way, since you have cancer, you have stage 3 prostate cancer, and you have COPD, don't even try to get a Medicare supplement. Even though he was 65, he turned 65 6 months ago. So he went with a zero premium Advantage plan. Because of his cancer treatment, he had to go outside the network. He paid $10,000 out of his own pocket within the first 3 months of having that Advantage plan. So anyway, he called me. And unfortunately, what I know that he didn't was in a Medicare supplement. If you have 6 months to get a Medicare supplement from the time you turn 65 with no health questions asked. You can get any Medicare supplement from any company, any plan, and you'll get the healthy low rate that a healthy person would at 65. So fortunately, there's another Medicare rule that says if you start off with an Advantage plan when you turn 65, you have a whole 12 months to decide to go back to a supplement with no health questions. They won't do a med check. They won't ask you about heart surgeries the last 2 years. They won't ask you about other medical procedures 10 years looking back. So we were able to get Oscar. Okay, so we exercised Oscar's trial right, which means he has 12 months to leave the Advantage plan and go on a original Medicare and a Medicare supplement. He'd have to get a standalone drug plan. But that's exactly what we did. And let me show Oscar to get out of the Advantage plan. What Oscar did was he enrolled in a standalone drug plan after his Medicare supplement was issued with a company by the name of United States Fire Insurance Company. Let me go over this real quick. I typed in his age. You can see 65 years old, male, Plan G. The Plan G pays everything that Medicare does not pay except a $198 deductible at the very beginning of the year. Once he hits that $198, a couple of doctor's visits, it pays 100% of everything. Hospital, no copays, no skilled care copays. It pays for foreign travel, and you leave your checkbook at home. There's no network. If he wants to go to the Mayo Clinic, which he's considering if his brother can help him get him down there. The Mayo Clinic, he'd pay nothing for his cancer treatment, the Mayo Clinic or MD Anderson. So with his Advantage plan, he could only receive care at Memorial Hospital in Savannah. It's the only place he could get his cancer care. So anyway, for a 65-year-old, we went with United States Fire Insurance. They're a A-rated company. I've seen their underwriting. Their underwriting is so much more challenging than any that I've seen. They ask so many questions. You basically have to be healthy as a horse to get through their underwriting, and I looked at their rate, and therefore they'll have a healthy pool of people. They're going to have less claims, and if you look at their age, whether it's 65, okay, let's look here. Members' health insurance wouldn't touch them. Blue Cross, they look very nice at 65. I'll show you later what their rates are if we have time. At 75, they skyrocket. Same with AARP. Humana, solid. The Achieve, I'd go with either that one for $113 a month. United States Insurance Company, $116. USAA, if you have access to USAA, fantastic. They're a great organization. So Humana, the fire insurance, or this, all right? And that's, you're looking at the 113, 116 range. You tell me what your drugs are. I put them into the software. It'll tell me which drug plan is best. It'll tell me which drug plan is best for you. You're going to have to get that as well. Last thing you want to do is look at the premium for a drug plan. That's the last thing you look at. The first thing you look at is, are your drugs covered, and at what tiers? Tier 1, Tier 2, Tier 3, Tier 4. Very expensive, Tier 4 and 5. So you need me to do this. If you make a mistake, you're going to pay for it. Maybe for a year, maybe for the rest of your life. Oscar was lucky. He found me, and we were able to exercise this guaranteed issue right, 1-year trial period, no underwriting. I got him in with the firefighters, A-rated, excellent company, very low rate increases. So anyway, feel free to go to MayRiverMedicare.com and you can look at all this. Well, maybe not this detail, but you can see the quotes.
You indicated that you're turning 65 or you're brand new to Medicare, Part B. If either of these is the case, then you have 6 months before that trigger date, starting Part B, or 6 months after to get on a Medicare supplement. You may recall from recent videos, you have 3 months on either side to do a Part D drug plan or a Medicare Advantage. But the Medicare supplement's much easier. You have 6 months on both sides. So the contact information we need below includes when is your trigger date, or did it already happen, for starting on Part B, and what is your location, your zip code, and we also need your age, because if you started Part B later, then we need to get an accurate quote for you based on your age. And do you use tobacco or not? Because some states make it, it's a factor when you do your open enrollment. Some states just don't care. So just to be safer than sorry, put that in there as well. Your health does not matter. If you're in open enrollment, you don't need to include anything about your health because it just doesn't matter. They don't look at it. So one time in your Medicare life, you can get a supplement with no health questions asked. So just fill in that information. We'll prioritize you to get this thing done. It's a very simple process. We'll compare all the companies and all the plans and make sure you are completely comfortable on how these plans work and answer any questions when we're making a recommendation for you based on what we find in the market and based on our experience of our dealings with these companies with hundreds of people we've helped. Thanks for reaching out to us. Thanks for coming to the website. And all the info on the form below is 100% secure. It's bank level encryption, so don't worry about us selling your information because we don't do that. You can feel safe and comfortable with the information you leave here. It'll only stay with us, and we'll put you on the highest priority list. It's a simple process. You get to pick any plan available in the market. Have your questions ready when we call. When we call, we'll be calling from either 843 or 912 area code. Look for that on your caller ID. Thanks for reaching out to us. And if you can answer the information below securely, we'll get back to you as soon as possible. Thank you.